With that being said, I want to introduce our first speaker, and we're very happy to have Dr. Mohammad here with us. He is a pediatric transplant hepatologist at Northwestern University. His research interests include long-term outcomes after liver transplant, and specifically autoimmune hepatitis. He's also very interested in the treatment of AIH as well, particularly given side effects and also the potential for relapse. He's interested in understanding how patient outcomes and how patients can gather their input and how they can be involved in this type of research can steer the future scientific gain. It's my pleasure to introduce to you Dr. Saeed Mohammad.
Hello, everybody. Thank you so much, Craig, for having me here, and thank you all for coming today. I'm going to talk a little bit about patient-centered outcomes research, and while I go into it, I'm just going to have some of our volunteers hand out the surveys that we want to have you guys fill out. You don't have to if you don't want to participate, but I just want you to take a look at them and see what we're asking. So like Craig said, there are a lot of gaps in our knowledge regarding AIH, and one of the ones that we're trying to bridge are what and how patients feel. So these surveys are really designed to answer the questions regarding quality of life. These are things that we don't often get the chance to ask in a clinic visit. We're asking, are you taking your medication? Are your numbers normal? Do you have any other problems? But these questionnaires are designed to ask, what's your quality of life? Trying to measure fatigue. Fatigue is something that is difficult to measure. It's difficult to quantify. But we want to know how patients, even those who are supposedly very well treated, still have fatigue. They still have maybe more anger. Now, some of these are for adults, and some of these are for children. And then there are for parents of children who have autoimmune hepatitis. So there are three separate kind of forms. If you are a parent and your child is not with you, you can fill out the parent form. It asks you about your child, and I just ask that you complete how you think your child feels. If you're an adult with autoimmune hepatitis, you fill out the adult form. And if you have somebody who's a child, which means under 18. So even if I heard somebody turned 18 yesterday, you do not qualify as a child, but happy birthday. So I'll say, traditionally, the way research has happened most of the time is that patients come into a clinician's office. They see, let's say, 100 patients. They start to identify a pattern. So autoimmune hepatitis is rare. We all know that. Presentation is very variable. Successful therapy is available, but has many side effects, and relapses are common. Go to the next slide. So traditionally, this is how research has happened. Is that you come to a clinician will see many patients, will observe that something commonly occurs. Let's say they start noticing that all these patients with autoimmune hepatitis have fatigue. Then they start thinking a little bit about it. They formulate a hypothesis saying, I think they have fatigue, or I think I can do this to change the fatigue. They design a study. Then they test it in the population. They have to recruit all the patients who have fatigue, who don't have fatigue. Then they analyze all the data, and then they come out with an outcome, and then they tell usually just their peers, the scientific community, what they found. Now, fatigue is something that clinician noticed or observed, but it may not be what the patients feel is the most important thing or is the most important problem affecting them. Can we go to the next slide? So what are patient-centered outcomes or patient-centered research? It's kind of getting the patient's opinion. So what are my options? What are the potential benefits and harms of the options? What can the patient do to improve outcomes that are most important to them? and how can clinicians and healthcare delivery systems work to help me make the best decision about my health and healthcare. Next. So the way that this is supposed to work, and this is the way that we're trying to develop using this conference, is that stakeholders who include the clinicians, who include parents, who include family members, patients, the community at large, they get together in the form, something could be like this association. They get together and they generate a question. So, I'll think of a question. A parent of a family member may think of a question. Members of the executive committee can think of questions. We all talk about it, and we try to decide amongst everybody which questions are important, which ones are going to give the most impact to the patient. Then they all sit down together and develop a research plan. Now, as a clinician, I can say I want the patients to come to my office, every week for blood draws, but that's not always practical. And it's good to have the patients on board to tell us what they can and what they can't do. So we all get together, we develop a research plan, we go forward with the testing, and then when the results come in, then everybody sits together and does the analysis. Now, you don't need to have a very detailed background in research to do the analysis. Some of it is easy. Some of it, even we can't do. We kind of ask statisticians to help us with. But the important thing is that all the data that comes in, everybody gets a chance to look at it and to try to interpret it from a clinician standpoint, patient standpoint as well. And finally, dissemination. So we want to have everybody know what we found. We don't want to just publish it in a scientific journal, but we want to have forums such as these where there are a lot of people who can benefit from it and tell their peers, their family members, and other people with autoimmune hepatitis what has been found and what can be done to improve outcomes. Next slide. So the aim of today for this part of the research is to collect data from patients, parents, and caregivers about what they perceive their health is. And then later, we're going to try to survey the group about what you guys would like to see going forward. What do you want us to study with you? What symptoms, what factors do you think are the most important for us to look at? Next slide. And then this is just an example of the questionnaire. These are called PROMISE questionnaires. They were developed by the NIH specifically to measure patient-reported outcomes. And they ask questions like, how would you say your child's health is? Do you think it's excellent, very good, fair? You don't have to, there are no right and wrong answers. You just check whatever box you really feel like your child. So this is for the child. If it was for yourself, it would just say, how would you feel like your health is? And you just tick the box. So this is for overall quality of life. There's going to be one for fatigue. There's one for how well you think you are able to kind of function. I think they would take about 5 to 7 minutes in total. We're asking that you guys try to complete it today. We'll have a box outside where you can drop it off at the end, and intermittently we'll have people maybe coming in. If you need help with anything, you can ask myself or Craig. And that's really all. Thank you so much.